Now the 16th topic of discussion was hypothermia. See, newborns are usually more prone to the hypothermia. Pathophysiology of hypothermia, thermogenesis, that is heat generation, is by shivering thermogenesis, and next is non-shivering thermogenesis. Shivering thermogenesis is seen in adults and older children. Non-shivering thermogenesis is seen in neonates. Non-shivering thermogenesis mechanism is less efficient than shivering thermogenesis. Non-shivering thermogenesis is dependent upon the brown fat. See, brown fat is situated or present over nape of neck, interscapular region, around the kidney and around the suprarenal glands, around the blood vessels. Brown fat basically generates high amount of ATP which gets converted to heat. Added to the non-shivering thermogenesis to avoid the heat loss, baby that is neonate attains a posture of flexion, that is flexion tone. Next, preterm babies are even more predisposed to hypothermia. Apart from the non-shivering thermogenesis, they have extensor tone which increases the heat loss, and they have a lack of stratum corneum, that is immature skin, which in turn leads to increased heat loss. Now we'll be going for what is known as classification or grading of hypothermia. Hypothermia is classified or graded as mild, moderate or severe. Actually, the normal body temperature was 36.5 degrees to 37.5 degrees. Mild hypothermia is 36 degrees to 36.4 degrees centigrade. It is also known as cold stress. Clinically, cold stress is abdomen warm and peripheries are cold, and moderate hypothermia is from 32 to 35.9 degrees centigrade, and severe hypothermia is less than 32 degrees centigrade. See, management of hypothermia: to prevent the hypothermia, maintain the labor room temperature and wipe the baby adequately. Make sure that the head of the baby was dry and put the baby in the radiant warmer. Radiant warmer is used in the babies who are less than 32 weeks. Radiant warmer is used in greater than 32 weeks of gestation baby, and incubator is used in the baby who is less than 32 weeks of gestation. So generally radiant warmer is easily and it is cheaper than the incubator. Now we'll be going for what is known as kangaroo mother care. Place the baby between the mother's breast in an upright position, that is hips flexed, abducted and the frog position, and arms flexed, head turned to one side and slightly extended. Baby's abdomen at the mother's epigastrium and supports the baby's bottom. And once it was done with based, it is whole of the KMC was usually based on the concept of skin to skin contact, KMC the next whole of the KMC helps in avoiding hypothermia, and KMC can be provided by mother or any female or male can provide KMC. It usually improves the maternal bonding and improves the lactation, increases the weight gain of the baby, and KMC also builds the mother's confidence and also decreases the hospital stay. But for providing the KMC, baby should be hemodynamically stable. Till what age the KMC should be given? Upper age limit is of 2.5 kgs and minimum limit is of 1.2 kgs. Since chances of apnea are usually very high at that such a lower limit. Both 2.5 and 1.2 kgs are not a birth weight, but these are actually that of weight of the child. See, in whole of the hypothermia, we are actually going to discuss regarding only 5 topics, I think so. First is definition. They will be going in detail regarding the definition, pathophysiology. Preterm babies, why the preterm babies are even more prone to the hypothermia, and next is classification or the grading of hypothermia and the management of hypothermia. This is whole sort regarding the hypothermia.